Therapeutic communication. This entails listening to and understanding clients while promoting clarification and getting insight. The goal of therapeutic communication is to understand the client's message, both the verbal and the non-verbal. You want to facilitate verbalization of feelings. You want to communicate understanding and acceptance. You want to identify problems, goals, and objectives. It is worth mentioning that nonverbal communications constitutes two-thirds of all communication and gives the most accurate reflection of attitude. A key point in psychiatric intervention is say nothing, just sit and listen. So what are you looking out for in nonverbal communication? You're looking out for physical appearance, body movement, posture, gesture, facial expression. You want to make and keep eye contact. Maintain physical distance. Okay, the person's feeling, and again, what he or she may verbalize may not match. For example, the client may deny feeling sad, but you're looking at him and you see he appears morose. So you want to look out for that in your client to match what they're saying with how they look, or the nonverbal with the verbal. Again, implied messages are as important to understand as overt behavior. How do I mean? For someone who continually interrupts, that may represent loneliness or fear. So you want to pick that out in your client. So what are therapeutic responses that we should engage in as registered nurses? So you'll be looking out for these therapeutic responses on the Nclex. For example, remain seated with your client, maintaining eye contact. Sit quietly and wait. Sit with your client. So this would be using silence. This will allow the client time to think and reflect. It also shows that you accept this client, you're conveying acceptance, and it allows the client to take lead in your conversation with him or her. Okay, what would you like to talk about? Then what? Go on. What brought you to the hospital? What can you tell me about your family? You are using broad openings. You are using general leads because you are prompting the patient. It's encouraging the client to talk. It allows the client to choose the subject. You could also use clarification. Give me an example. Tell me more. And how do you feel when you're angry? Who are they? You're trying to clarify. This would encourage recall and details of particular experience. It encourages description of feelings. It seeks clarification, pinpoints specific. Another therapeutic response you may use will be reflecting. You want to paraphrase what the client says, reflect what the client says, especially the feeling that is conveyed. For example, it sounds like you are feeling angry. You are reflecting what the client is telling you. You're paraphrasing what he's telling you. In other words, you really felt abandoned. That's also reflecting. I hear you saying it was hard to come to the hospital. That's also an example of reflecting. So what are responses to avoid in therapeutic communication? How many children do you have? Who do you live with? My father. Are you feeling better today? Yes. You need to avoid close-ended questions that can be answered by a yes or no or other monosyllabic responses, because this prevents sharing and it puts pressure on the client. Again, why don't you? Why don't you do this? You really should cut your hair and wear makeup. Advice giving. Avoid giving advice. It encourages dependency and it may not be right for a particular client. Again, avoid responding to questions that are related to one's qualification or personal life in an embarrassed or concrete way. For example, yes, I'm highly qualified. You know, nurses are not permitted to go out with their clients. Avoid responding to questions that are related to your qualification or personal life in an embarrassed or concrete way. Arguing or responding in a hostile way is not therapeutic. For example, if you say to your client, if you do not take your medication, there's really nothing we can do to help you. This is not therapeutic. Again, reassuring. You will start feeling much better any day. These are false reassurance. Don't worry, your doctors will do everything necessary for your care. These are false reassurance. So client benefits more by exploring their own ideas and feelings. So avoid false reassuring. Again, avoid why questions. Why didn't you take your medication? This is already going to put the client on a defensive mode, and it implies disapproval. So avoid why questions. Also avoid judgmental responses where you evaluate clients from the nurse's own values. Avoid that. It's not therapeutic. You were wrong to do that. Don't you think that your being unfaithful has destroyed your marriage? That's being judgmental.